Hi, this is Pei Zhang. This is our fifth lecture of the certification exam prep course. And today the topic is practice, practice, and practice. Now, probably there's still some time till your scheduled exam. And what you can do to use your time more efficiently is to make a study plan. It can contain the following items. First, read NBCMI or CCHI candidates examination handbook, which are available on their respective websites. Within the handbook, you can review the certification process to plan your time wisely. You can review the test content outline in greater detail to know what is going to be tested on the exam. You can also view the recorded free webinar about NBCMI certification test and decide if this is something you'd like to achieve. Second, register yourself for the certification exam, paying the fees and schedule your written exam as the first step if you want. Then, download and carefully study all the documents mentioned in the candidate's handbook or in this exam prep course, including those code of ethics, standards of practice, and laws and regulations. What's left is just to keep reviewing medical terminologies in both English and your target language, and practice your interpreting skills in different modes. Concentrate on consecutive interpretation, also practice side interpretation, and if you're taking the CCHI exam, don't forget simultaneous interpretation. I'll explain more about how to practice interpretation skills in the following lecture and in my next lecture. In the last week before your exam, you can take the mock exam put out by NBCMI or CCHI and get familiar with the test format. Don't do it too early as you will need it as a warm-up exercise. It's also a good idea to think of some relaxation techniques to reduce testing anxiety. Also, for the site translation, you should find some materials to practice with. You can Google some patient intake forms, informed consent forms for various treatment and procedures, or even clinical trials, legal waivers, healthcare proxy, and patient education material, like a flyer or brochure giving you basic knowledge about certain diseases or how to prevent them. When you're practicing with these, try record your own answer and grade yourself afterwards. This way you can see where you have missed and improve faster. What's vital in the oral exam is your note-taking skills, and this should take up a major part in your exam preparation time. The first step is to develop your own symbols. You can use some symbols from math, for example, because, therefore, positive, minus, greater than, less than, about or around a certain number, correct, etc. Some other symbols can be intuitive, like increase, decrease, money or cost, heart or like something. Star can mean very important. Use an X to mark something unknown. Question mark represents a question. Smiley face means happy, etc. Note that you will also need symbols for describing patient or symptoms, like male, female, left or right side, etc. These are far from exhaustive, and you need to try and practice with them until you're proficient. A simple way of practice is to take notes while listening to a short podcast or a YouTube video, which can be medical relevant or even just daily conversation scenarios. After a few sentences, pause and try to reproduce the information from your notes, and always check your accuracy rate. Some more tips on how to broaden your medical vocabulary. You can start by getting a list of commonly used word roots in medical terms. For example, when you see the word cholelithiasis, you can realize chole is something related to gallbladder. Litho means stones. Asis often refers to a disease or condition. Then you know it's probably gallstone. Or when you see the word gastritis, you know gastro is something about stomach. Itis means inflammation. Then you know it's inflammation of the stomach. Gathering word roots can help your medical vocab grow much faster. Then you can search for a medical vocabulary list online. For example, there is a mini glossary put out by the CCHI, or something recommended by Meteor in our useful resources. Or what I did was searching for bilingual medical vocabulary list for graduate school entrance exam in your country. Anyways, choosing something that's not too comprehensive to an extent which is too much to go through, but also something a bit beyond your level so that you still get some challenges. It's better if you review the healthcare terminology in English by systems and appointment type, like prenatal visits, ER visits, various specialty types, hospital stays, and more. Don't forget about terminology related to nutrition, dentistry, and mental health. Lastly, you can make a set of flashcards in your smartphone. Get one of those flashcard apps and start gathering the words you always get stuck on. Review them often, especially on the last few days before your exam. Although a paper-based dictionary is allowed in NBCMI oral exam, trust me, you would rather use the precious 10 seconds in refining your answer or something else. Flipping through dictionary within the limited time is very stressful, and it may let you miss more important information that follows. So, of course, the more medical terms you have in mind, the better you will perform.